Hi, greetings from the University of Port Harcourt. I am Miss Obanga Queen, a final year medical student from the University of Port Harcourt. In line with technological advances, the Port Harcourt University Medical Student Association, PUMSA, of which I'm a proud member of, is hosting its very first podcast. Now, on this episode, we will be talking about febrile convulsion, among other topics that would be important to your well-being. Joining me today is my highly intellectual friend and colleague, a final year medical student. So I would allow him to introduce himself.
Hello everyone, I am Fortune. I'm final year medical student. I'm very delighted to be here, not just because I'm a final year medical student, perhaps because I experienced, I had febrile convulsion growing up as a child. So thank you very much for having me here.
Febrile convulsion is a topic of public health importance. Usually, many mothers experience seizures in their children, but rather than proper treatment, they take advice from their oversavvy friends and family that give them remedies with usually poor outcomes. So it's really delightful that we have an expert on the topic, my friend and colleague, who is going to guide us on the proper thing to do if we ever experience seizures in our children. So, my chief, please could you tell our audience what febrile convulsions are and what causes them?
Okay, first I would want to say, when we use the term, when we say febrile, we mean presence of fever. Okay, and when we say seizures, we mean a set of signs and symptoms that are resulting as a result of excessive neuronal activity in the brain. Okay, so when you say febrile convulsion, that means there is seizure associated with fever. So I think that's it.
So, what are the causes of these febrile seizures?
Okay, the exact cause of febrile seizures is not really known, but however, the finding is that seizures occur in the presence of fever, and some postulations have it that because there is an ongoing inflammatory process or an infective process, there is release of inflammatory mediators that could alter the activities of neurons in the brain. Okay, and so we could trace the causes of febrile convulsion to the common causes of fever in our environment, such as malaria and maybe upper respiratory tract infections like throat infection. The child could also have an ear infection. The child could have urinary tract infection, and also even lower respiratory tract infections like pneumonia, bronchopneumonia. So because this precipitate fever, they could actually lead to convulsions or seizures.
So, what are the things you see in children with seizures?
In children with seizures, we have presence of fever, temperatures above 38 degrees Celsius, and then there could be loss of consciousness. The child can pass out, and then there could be opening of the eyes, have increased salivation, and then we could then have the motor symptom, which everyone knows as convulsion, the jerky movement of the muscles of the limb,
Really
there could be twitching, there could be stiffness of the muscles of the limb, and there could be sphincter dysfunction where the child can then pass out stool or pass urine, and in the process. So these are some of the symptoms you see children.
Now, why is this different from other convulsion types?
It's different from other forms of seizures in that it occurs, there is a particular age range between 6 months and 5 years. And then secondly, febrile seizures occur in the presence of fever, associated with fever. And then there is no underlying brain disorder or brain infection or CNS infection. There is no metabolic abnormality, like let's say low blood sugar, high blood sugar, or low calcium level, high sodium level. There's nothing like that. And there is no previous history of a febrile seizure, like a child having seizure before now. So it's just occurring in a child within this age range. There's presence of fever and no other underlying abnormality.
So you've mentioned the age group affected by these febrile seizures. So what are the things or risk factors that predispose a child to having it, and what increases the risk of this occurring again?
Okay. For the first time seizure is usually unpredictable. Okay. you can't just anticipate a child is having fever. You can't just anticipate that there will be seizures. So, but there are some risk factors like being in that age range. It's a risk factor. Then also fever itself is a risk factor. But for recurrence, certain factors may predispose to recurrence, like if a child has a positive family history of febrile convulsions, and then also if a child has experienced febrile convulsion before, a previous history is a risk factor. Also, a child that experienced febrile convulsion before 12 months of age, that's age less than 12 months, also a risk factor. Or if a child has a complex type of febrile seizure, that's also a risk factor for a recurrence.
Okay. And is there anything that is there any way the mother can cause febrile convulsion in a child? Can it be transferred? Can an infection in the mother cause febrile convulsion in children?
Not necessarily. Like I said, febrile convulsion results from the presence of fever in the child, and that's what predisposes to the excessively high temperature is a predisposing factor to the convulsions and seizures.
Now, for the next set of questions, I want to know, how should parents handle this situation, and how dangerous could these seizures be, and what could they possibly be doing wrong?
Okay, I like to approach this question in my personal story. But before that, let me just mention things parents should do. Febrile seizure is usually very frightening when it occurs, and parents are anxious. Some parents will scream for their neighbors to come around, and then that usually leads them to doing all sorts of wrong things. So I would want to tell the parents out there to be calm, don't panic when your child has a febrile seizure. If your child is standing or sitting, you would want to gently carry your child and place on the ground. Remove any object that is going to injure this child while the child is fitting or seizuring. So when you remove any object that is going to injure the child, you want to loosen tight fitting clothing around the neck, around the head. If your child uses glasses, you want to take off the glasses. And when you're placing the child on the floor, you want to place the child lying on the side. So and the head a bit tilted downwards to avoid aspiration. Because the seizure won't kill the child, but the aspiration will.
What is this aspiration?
Okay, I mentioned saliva secretion earlier on, and then because of the lack of control, the child is not conscious, is not able to control or coordinate swallowing while feeding, and some of these salivary secretions can get into the lungs, and that leads to aspiration pneumonitis and other complications. So having positioned your child and the child is fitting, usually febrile seizure doesn't last a long time, less than 5 minutes, and then next is observe your child, because you're going to take this child to a doctor. You want to describe how the fitting was, because the doctor will ask you. So you want to observe your child. You want to record with your phone. If you have your phone there, you can video the seizure so that it saves you. You just show your doctor. So these are sorts of things you can do. And after the seizures has ended, you want to place your child in a recovery position. Okay, because you still want to avoid aspiration. Recovery position, although there are steps to doing that, but basically it's about placing the child on the sides and then tilting the head a bit downwards, ensuring the airway is open to avoid aspiration. So basically, these are what
you were about to tell us about your personal story.
Oh, okay. I want to talk about that. Okay, let me just delve into what parents should not do. Using my personal story, I was told I had febrile seizure. Okay, growing up as a child, and okay, when that happened, I was fitting. My mom cried out for the neighbors to come out. They came around, and next people were coming with different suggestions. Some were like, his body is too hot, throw him inside the water, and then they took me and they threw me inside the tank of water, and they brought me after which they brought me out. The next person came, his eyes are rolling up, let's put things in his eyes. So they got onion, they got pepper, red oil, they were putting things into my eyes. And another person came and was like, no, this thing, I think they flogged me also with scent leaf. Then someone having thrown me to the water, my temperature is already going low. So it's now cold. And now, let's take him to the fire. And then they took me to the fire and they dropped me beside the fire. And that was when I had sphincter dysfunction, and then I passed out urine and physics. And they said, because I passed out urine and physics, I'm recovering. Do you get? So that's like when you mentioned the wasabi neighbors and all. So these are things you shouldn't do. Okay, I forgot to mention, they asked my mom to get spoon to put into my mouth. Yeah. And then there was no spoon. My mom had to use her hand, and I beat her hand. So the don'ts, I would say, is when your child has seizure, don't panic. You calm down, calm your nerves down. Okay. Don't try to put things in the child's eyes. Don't try to put anything in the child's mouth. Don't try to move your child or restrain your child from fitting. Rather, place your child, as already mentioned. Okay. And passing stool or urine doesn't mean the child is recovering or not recovering. That's a very huge misconception. And okay.
And for from your story, it seems that these convulsions can be very severe.
Yeah. Okay. Febrile seizure can be simple, it can be complex. Okay. For the simple febrile seizure, it's usually generalized tonic-clonic. What I mean is, there is contraction and relaxation of the muscles, but it's all over the body and usually lasts less than 15 minutes. And that's simple. But the complex one usually focal on one part of the body, and that one has a poorer prognosis. So when it happens, it's frightening. And for the parents, when you see your child fitting, a lot of things you go through your mind and think you're about losing your child, but it's generally harmless.
But could it lead to death in any way?
The seizures won't kill the child. What could kill the child are these other things, wrong practices. Imagine when I was thrown into the water, I could have aspirated water into my lungs. Absolutely. That could have happened. Okay, imagine putting a spoon into my mouth. You could, because my jaws are clenching, like you could injure my teeth. You could kick out one of my teeth and aspirate it. Do you understand? These are things that could lead to the complications. So what to do has already been described.
Thank you so much. Mm-hmm. Now we're going to be taking another set of questions. So my boss, now these febrile seizures, how can they be prevented? What can the parents do to prevent this?
Okay, as mentioned earlier, febrile seizures are unpredictable. Okay, what parents can do to prevent it? If your child has fever, you should be able to give antipyretics to lower the temperature, or you could do tepid sponging, not throwing the child into water per se, but use a towel, soak in water, and tap on the child's body, and basically. So also contact your doctor. Any presentation to the hospital, don't allow your child to get sick, and you're not going to the hospital. Any presentation to the hospital is key. Once your child is here, call your doctor. Let your doctor know.
Aside that, is there any specific medication that you can give your child?
Basically, antipyretics, basically. The other medications are for doctors to give.
And the antipyretics are for fevers, right?
Yeah, like paracetamol. You can give paracetamol for fever. Yeah.
Okay, and when you take your child to the hospital, how will the doctor know what type of convulsion this child is having?
Okay, basically what to expect when you get to the hospital. The prime concern of the doctor is one to do resuscitative measures in case peradventure your child is fitting a presentation. The doctor would want to ensure he aborts the seizure, and there are certain medications that are used to abort seizures. The doctor would also want to ensure the airway of your child is patent and clear, aspirated, suction any secretions, and ensure the circulation is okay. Then your doctor, secondly, would be concerned about finding the underlying cause of the fever, and is going to take a history. And that history entails engaging you, asking you questions, trying to allow you to describe the seizures. That's why I say you should pre-record. You should record the seizure if you have your phone. So your doctor will want to look at this video and know, is it focal, is it generalized? And doctors have their way to go about that. Okay. And then subsequently, from the history, doctor will go ahead to examine your child, do a neurological examination and examine other systems of the body. And from there, he's also going to know, okay, what investigations to do or not to do per se. Sometimes after thorough examination, you find out that it was just a simple febrile seizure and it's not a big deal. Sometimes just giving antipyretics and then treating the underlying cause will suffice. But at other times, you might want to investigate, especially when the seizure is complex. Yeah.
Thank you so much, my boss, for this enlightening talk on febrile convulsions. I bet with your personal story, a lot of parents should know by now what not to do. So in summary, what would you advise parents to do when they're managing this kind of condition for future episodes?
Okay, febrile convulsion, like I mentioned, febrile seizures, like I mentioned, is frightening, but generally harmless. Okay, so I would want to tell parents to don't panic, calm your nerves down, and then if your child is sitting or standing while fitting or seizuring, you want to bring gently carry your child to the ground or the floor, and then you place your child lying on the side. Remove any object that is going to be that is going to injure this child or be traumatic to the head. After that, you want to remove glasses. If the child uses glasses, you want to remove tight-fitting clothing or losing, not really remove, losing tight-fitting clothing around the head and the neck. And then you want to record or observe the seizures, the pattern. You want to record it or video it. And at the end of the seizure, you want to place your child in a resting recovery position. When you place your child in a recovery position, then next you have to call your doctor. You have to let your doctor know about what has happened or take your child to the hospital.
Will vaccinations help in preventing these diseases?
And that would be up to research, vaccination, but preventing diseases that lead to febrile convulsion, vaccinations should be very, very vital. Very, very vital. However, to sound somehow. However, post-vaccination, a child can have febrile seizure.
Oh, those complications.
Yeah, but it's not the vaccination per se that leads to the febrile seizure. It's actually post-vaccinal fever, like a child after vaccination, sometimes they have reactions like fever. When the fever is now leading to extremes of temperature, it can predispose to febrile seizures, but it's not the vaccine itself that's causing the seizures.
Having heard the advice from my chief, Dr. to be Fortune, I hope now the adults and new parents know what to do when their child has a seizure. Please don't go about baptizing your child in water. Leave that for your pastors, okay? Once again, I am Miss Obanga Queen, and
I am Ihe Ichukwu Fortune.
we will see you in the next episode. Bye!